A liberal arts education is a good fit for students interested in healthcare careers because actually it gives them a chance to obtain a broader perspective that they can then later bring to bear on their healthcare career.
If a student is interested in health sciences as their career, they don't have to pick any major in particular. What they need to do is to think about what are the prerequisites for that discipline, and then how do I get that in a major that I'm interested in as an undergraduate. So if you want to choose a science-specific major like physiology, it comes along quite naturally, but you could also be a psychology major, you could be an art major, you could be a history major, but as long as you get those prereqs in, you can still go to health science professional schools.
I'm interested in a lot more things than just healthcare and just science, and CLA gave me the opportunity to study a language, study abroad, study history, all these other cool things, in addition to fulfilling my requirements for pharmacy school.
I had this sort of almost eureka moment when I was an undergraduate, and I had started out as a biology major, of course, because I was pre-med. And then I realized, well, wait a minute, I'm almost done with all of my pre-med requirements. And I'm really liking these literature and philosophy courses that I'm taking, kind of more than the science, but don't tell everybody. And it dawned on me I could major really in whatever I wanted, and I could still take the MCAT. I've taken a much more imaginative view to what my career could be than if I had just gone, down the straight and narrow conventional path.
You will find our students across the healthcare spectrum. We send students to medical school, dental school, pharmacy school, physician's assistant school, physical therapy, public health. Getting a good liberal arts education is going to give you perspective on how people relate to one another in different parts of the world, how they view healthcare in other parts of the world. And if you're going to be a 21st century healthcare professional, I think that having that background is going to be essential.
There's growing evidence that much of what really is conducive to healing is not just the medical treatments or the surgeries or the devices that we're using, but really the social human context in which it's delivered.
There are so many opportunities within CLA for a pre-health student, and the CLA advising staff is so helpful.
Any student who becomes a physiology major, or for that matter, biology, society, environment, or Spanish, or any of the other disciplines in CLA, they end up with more than one advisor. They have a college-level advisor who can help them with classes in general. They have a major advisor, and I'm one of the major advisors. And then there's also a careers office in CLA that can provide you with information. So you have really a team of people who can help you. It's in the student's best interest to then seek out the members of that team. And if one person doesn't give you all the answers that you need, say, well, who else would you recommend? And usually they'll point you to one of the other members of that team so that you can get all the information you need.
These people are so valuable. They've helped students in your position so many times. They've seen people applying for these programs. They know it works. But I think there isn't really a way to confirm that a health professional program is right for you unless you get hands-on experience. My experience as a pharmacy technician, volunteering in an inpatient pharmacy, being involved in a pre-pharmacy club, all of these different things really helped me confirm that pharmacy was right for me.
Think about the fact that healthcare is first and foremost a human activity involving other people. And these are not easy professions. They're often dealing with great suffering, questions of life and death. And so in those moments when you're really the doctor or the nurse or the caregiver of whatever kind, it's not enough to know the chemistry, and it's not enough to know the biology. I think it really helps to have exposure to literature and the arts and things like philosophy to really feel grounded in times like that with your patients.
You think of science and pharmacy and research as, numbers and just a very definite result. But I think CLA gave me the opportunity to see how it actually impacts people.